So today we've been called to a residential address for migraine-like symptoms. I'm going to have to refer to the red flag sections of St John's Clinical Guidelines and Procedures in order to determine whether my patient needs to be transported to a medical facility, and if so, which medical facility is appropriate. But before referring to this section, I'm going to introduce myself to the patient and perform a full assessment. Hi, my name's Christine. What's your name?
My name's Carmen.
What's been going on today?
I just have a bad headache.
Okay, Carmen. Well, before we decide what we're going to do about that, I'm just going to get my offsider to take a full set of vital signs, and I'm going to ask you a few questions. Are you alright with that?
Yep.
So, Carmen, when did your headache begin?
It started at about 11 o'clock this morning when I woke up, and the throbbing's just gotten gradually worse.
Okay, so I've asked Carmen about the onset of her pain because subarachnoid hemorrhages may present with sudden onset of a severe headache. Carmen, do you usually suffer from migraines or any other medical conditions that I should be aware of?
I usually have migraines.
And no other medical conditions?
No.
Okay, so Carmen's a chronic migraine sufferer, and Carmen has said her pain has come on over the last couple of hours and it's throbbing in nature. This is unlikely to be pain caused by meningitis because meningitis type or like pain usually comes on more slowly and the pain is constant in nature. So does anything make the pain better or worse for you, Carmen?
No.
Okay, so you don't have any pain when you're moving your neck? Could you just look? Yep.
No, it's still the same.
No pain?
No.
Okay, so Carmen has no pain on neck manipulation and you don't have any neck stiffness?
No, it feels the same.
Okay, alright. Because neck stiffness or pain in neck manipulation can be seen with subarachnoid hemorrhages or a meningitis. Can you describe the pain for me, Carmen?
It feels like a throbbing pain.
Okay. Does the pain radiate anywhere?
No, it's just kind of staying in my forehead area.
Okay. Is that normally where you get your migraine-like pain? Okay, could you rate, if you had to rate that pain out of 1 or out of 10, where would you rate it on that scale?
Probably about a 4.
Okay, and is that usually about the severity of pain you have when you normally have a migraine?
Yeah.
So there's just a few additional symptoms that I want to rule out to make sure that this pain is from Carmen's normal migraines. So Carmen, have you had any severe or persistent vomiting?
No.
I'm now going to get Carmen to perform a fast test to make sure that she has no focal neurological deficit. Could you squeeze my hands? So no unilateral weakness. Carmen, could you do a big smile for me? No facial droop. Could you place your hands out like that? And then with your eyes closed, could you rotate them, palms up? And neither one of her arms is drooping. That's fine, Carmen, you can relax now. I'm now going to shine a light in her eyes to make sure that her pupils are equal and they dilate. So Carmen's pupils were equal and reactive to light. I'm going to do the finger to nose test. Carmen, could you place your finger on your nose and bring it to my finger? So that's good. Carmen didn't have a problem doing that. Carmen, have you had a runny or blocked nose over the last few days?
No.
So I wanted to rule out sinusitis, a pain caused by a sinusitis. I now want to assess for signs of temporal arthritis. So has Carmen had any altered vision, blurred vision?
No.
No. Has Carmen had any loss of appetite, fever, jaw, shoulder, hip pain?
No.
No. No sensitivity in the scalp or temple areas?
No.
Okay. Now I want to make sure that Carmen doesn't have any dizziness or trouble walking. Carmen, could you walk towards me, please? Is that alright for you?
Yeah.
No dizziness? You didn't feel unbalanced?
No, it feels good.
Okay. So because Carmen doesn't meet any of the red flags, I'm going to recommend that she stays at home. She doesn't need transport to an ED, and she doesn't have any orange flags, so she doesn't need to see a GP within 12 hours. She has one green flag, which is her normal migraine symptoms. So I'm going to recommend that she rests and takes 1 gram of paracetamol and 400 milligrams of ibuprofen every 4 to 6 hours, no more than 4 times in a 24-hour period. Carmen, would you like some paracetamol and some Brufen for your pain?
Yes, please.
You haven't taken any within the last 4 hours?
No.
And you don't have any allergies?
No.
So I'm going to make sure that I drug check this with my partner for expiry date, right dose, and obviously right drug. And I'm going to advise Carmen to see her GP if her symptoms worsen, or call 111 if her symptoms change and she becomes concerned. One last thing before I leave Carmen at home, I'm going to make sure I check my non-transport checklist with my OSCE before we leave, and I am going to double check that she doesn't meet any of the red flags or the orange flags, because we can't leave her at home if she does. So today we've been called to a residential address for back pain. I'm going to have to refer to my red flag section in the clinical guidelines to determine whether my patient needs to be transported to a medical facility, and if so, what type of medical facility. However, before I do that, I'm going to perform a full assessment and introduce myself to the patient. So hi, my name's Christine. What's your name?
Carmen.
And what's been going on today?
I was lifting a heavy box just before, about an hour ago, and I just got a bit of a sore back.
Okay, so you didn't wake up with any back pain?
Nah, it just started an hour ago.
So you definitely think that lifting the box was a trigger of...
I think so, yeah, definitely, yeah.
Okay. Have you ever had that pain before when you've done any heavy lifting?
Yeah, I have had that before, and I had to go to physio.
Okay, you did? Whereabouts in your back is the pain?
It's kind of like in my lower back, lumbar area.
Okay, alright. Well, Carmen, I'm just going to perform an assessment of your abdomen and your back. Is that alright with you?
Yeah.
Okay. So I've got Carmen lying down so that I can perform a full assessment of her abdomen, looking for any tenderness, rigidity, guarding, or referred pain. I also wanted to know if the pain worsens while you're lying down, Carmen.
No, not just say about the same.
Okay, so Carmen, do you mind if I do a quick assessment of your stomach?
Yeah.
Okay. So just looking at Carmen's stomach now, I don't see any hematomas or lacerations or anything like that, or bruising. Let me know if this causes any pain, Carmen. Is that feeling alright?
Yeah.
And that's not making your back pain worse?
No.
Alright. So Carmen's abdomen is nice and soft, which is a good sign, and she had no referred pain through to her back while I was palpating. If she did, this can indicate things like peptic ulceration, cholecystitis, pancreatitis, or nephritis, or polynephritis. So I've now got Carmen lying on her back because I want to rule out cervical tenderness, lacerations, crepitus, just to make sure that the back pain is lumbar, any bumps or anything like that, any abnormalities. So Carmen, do you mind if I lift up your shirt and have a feel down your spine?
Yeah.
Okay, I just want you to let me know if it causes any pain, okay? Have you got any pain there?
No.
So Carmen has no pain or bony tenderness while when I've been palpating her cervical spine. I'm also looking down the length of her back to make sure I can't see any lacerations, contusions, or any crepitus or hematomas. Carmen, have you got any pain there?
No.
What about here?
No, it's more down.
Okay. Just there?
Yeah, but it's kind of more generalised in the lower area.
Okay, just when I was having a feel there.
Yeah.
Okay. Alright. So Carmen had no obvious signs, contusions, deformities, hematomas, but she was complaining of some diffuse tenderness when I was palpating her lumbar spine there. So Carmen, how would you describe your pain to me?
It's kind of like a dull aching pain.
Okay. And it doesn't radiate anywhere?
No.
Alright. And what, out of 10, how bad is that pain?
Probably about a 4.
Okay. Alright. And that's about the same level of pain you had when you last hurt your back?
Yeah.
Okay. So I'm now going to roll out some additional symptoms and ask Carmen a few extra questions. Carmen, have you had any loss of bladder control or bowel control?
No.
And you've got no loss of sensation in your upper thighs, your perineum, which is just between your legs, or your bottom?
No.
Could you just have a feel?
No, it feels normal.
And it doesn't feel different?
No.
Sometimes this can indicate compression of the spinal cord if Carmen was experiencing any of these symptoms. So I now want to watch Carmen mobilise towards me to rule out any altered sensation, make sure she doesn't experience any dizziness or loss of balance while she's walking. It's also common for someone with lumbar spine pain to have difficulty walking supine, so they lean forward to help with the pain. Walk towards me, please. Is that alright for you?
Yeah.
Just to further rule out infection, Carmen, you haven't had any rigours? They're like chills or shivers?
No.
No? So my diagnosis for Carmen is that she does have lumbar back pain and she doesn't meet any of the red flag sections, so she doesn't need to be immediately transported to ED. She doesn't have any orange flags either, so she doesn't need to be transported to, or she doesn't need to see a GP within the last 12 hours. She meets all the green flags. She has pain or muscle spasm isolated to the lumbar area. She's able to walk and she has normal vital signs. So I'm now just going to give Carmen some advice before we leave her at home. So Carmen, it's really important that you remain mobile with that pain in your back, alright?
Okay.
You can also take paracetamol or brufen every 4 to 6 hours up to 4 times in a 24-hour period. Would you like some now?
Yes, please.
So I'm going to give Carmen the adult dose of paracetamol and brufen. Carmen, do you weigh under 80 kilos?
Yep.
But you weigh over 50 kilos?
Yep.
So I'm going to give Carmen 1 gram of paracetamol and 400 milligrams of brufen. So that's 2 tablets of each drug. I'm going to make sure that these packets have been drug checked by my offsider for expiry date, and making sure that I'm giving the right dose, and of course making sure that I'm giving the right drug. So now that we've given Carmen that medication, Carmen, if your pain worsens or your symptoms don't get better, you can go and visit your GP, or if you become really concerned, don't hesitate to call 111 back. Before we leave Carmen at home, I'm just going to make sure I check my non-transport checklist. So we've been called to the residential address of a runner today who is complaining of an ankle injury. Hi, my name's Christine. What's your name?
I'm Carmen. I was just going for a run about half an hour ago and I fell over and twisted my ankle.
Okay, what ankle is it that you hurt?
My right ankle.
Okay, did you walk home from the park this morning?
Yeah, I did.
Okay. So now that I've introduced myself to Carmen and I've determined what Carmen's chief complaint is, I'm going to perform a secondary survey and task my offsider to grab me a full set of vital signs. However, for the purposes of this video and the time constraints, I'm not going to perform a secondary survey. The secondary survey would reveal no other injuries in this case. The vital signs came back as normal. The BGR was 6.5, temperature was 36.5, blood pressure was 120 over 80, and heart rate was 80. So this rules out possible medical causes of Carmen's fall, such as hypoglycemia, hypotension, infection, tachycardia, or bradycardia. So it's Carmen's right ankle that's causing her the distress today. I'm going to compare the perfusion sensation and temperature of Carmen's unaffected ankle to her affected ankle. So first I'm going to compare the temperature of each foot, and they're both of equal temperature. I'm now going to look at perfusion status. So the capillary refill is less than 2 seconds on both sides. I'm also going to compare pedal pulses. So I've found the pedal pulse on Carmen's left ankle and I'm going to mark that. And I'm now looking for it on her right ankle, which I've found. I'm also going to be looking for ankle pulses. So I've found one there. And I've found one here. So I don't think the perfusion status of Carmen's right ankle's compromised right now. I'm also going to compare sensation. So Carmen, can you feel me running? Can you feel me running my hand up the back of your foot on your left side there?
Yep.
And can you feel it on your right side?
Yep.
And you have no numbness and tingling in your right foot?
No.
And none in your left foot?
No.
And can you wriggle your toes on your left side for me? And can you wriggle them on your right side for me? So now that I've compared the perfusion sensation in temperature of both feet, I'm going to use the Ottawa ankle rules to decide whether Carmen needs to be transported to ED for an x-ray. So an ankle only requires x-ray if there is bony tenderness at the posterior tip of Carmen's lateral malleolus. Carmen, is that causing you any pain?
No.
And I'm palpating 6 centimetres upward. And if there is bony tenderness at the posterior or tip of Carmen's medial malleolus. Carmen, is that causing you any pain there?
No.
Okay. And I'm now gonna, the foot only requires x-ray if there is bony tenderness at the base of Carmen's 5th metatarsal. Carmen, have you got any pain there?
No.
And if there is bony tenderness at Carmen's navicular joint. Carmen, is there any pain there?
No.
So given that Carmen told me that she walked home, I'm going to assume that she was able to mobilise immediately after the event occurred. However, to rule out an x-ray, I need to see her walk 4 complete steps as well. Carmen, could you please take 4 complete steps toward me? Did that cause you any pain, Carmen?
I was a little bit sore, but I think it was manageable.
Okay, cool. So I'm only able to apply the Ottawa ankle rules to Carmen if she is over the age of 18. Carmen, how old are you?
20.
20. If she's not intoxicated or being uncooperative, if the patient doesn't have any other distracting injuries, if the patient doesn't have diminished sensation to her legs, and if a patient doesn't have gross swelling preventing the palpation of the malleolar bone for tenderness. However, none of this criteria applies to Carmen in this situation, and she's passed all of the Ottawa ankle rules. I do not think Carmen's ankle requires an x-ray, and I think Carmen is safe to remain at home if she rests, ices, compresses, and elevates her ankle. So I'm just going to demonstrate resting, icing, compressing, and elevating Carmen's ankle. So Carmen, I'm just going to wrap your ankle, alright, to add some protection.
Yep.
So I'm wrapping it in a figure 8-like way, and I'm using a triangular bandage. However, I would be using a crepe bandage if I had one. And Carmen, I'm just going to slip this pillow under here. We want to keep your ankle elevated, alright?
Okay.
And I'm just going to apply some ice to Carmen's ankle. And Carmen, keep that rested as much as you can, alright?
Okay.
So I'm going to give you some paracetamol and ibuprofen. Those are safe medications to give Carmen even though we're leaving her at home. So I've got my paracetamol here and my ibuprofen, which has been drug checked by my partner for expiry date, dose, and making sure that is paracetamol and ibuprofen. So I'm going to give Carmen the adult dose because she weighs over 50 kilograms. So for paracetamol, that's 1,000 milligrams, and for ibuprofen, that's 400 milligrams. So that's 2 paracetamol tablets and 2 ibuprofen tablets. Before I give that, I'm just going to check that Carmen doesn't have any allergies. Carmen, you don't have any allergies that I should be aware of?
No.
And I'm also going to check that Carmen hasn't taken any paracetamol or ibuprofen in the last 4 hours. Have you taken any in the last 4 hours, Carmen?
No.
So it's safe to give Carmen this medication. So I'm just going to give her some water and let her do that herself. Carmen, you can take paracetamol and ibuprofen every 4 to 6 hours, up to 4 times a day, just while you're helping mask that pain. All right?
Okay.
And before we leave Carmen at home, I'm going to be checking my non-transport checklist. So making sure that the patient's been fully assessed, including a set of vital signs and all appropriate investigations, which she has. None of the vital signs are significantly abnormal. They're not. We mentioned them before. Serious illness or other injuries being ruled out. We did that with a secondary survey. Carmen, you don't have any existing medical conditions that we should be aware of?
No.
So she doesn't. No red flags are present if the condition is one within the red flag section, which it's not. The patient's been seen to mobilise while she was when we were trying to rule out the Ottawa ankle rules. And the patient's left in the presence of caregivers or has been given an explanation of when to seek extra help, and all information's been documented on the e-period. So Carmen, if your symptoms worsen or you are unable to wait there, don't have any hesitation going to see your GP the next day, or you can always ring us back and we can transport you to ED to get an x-ray.
Okay, thank you.
Sweet. So, as I approach Carmen, I'm going to task my OSCE to grabbing a full set of vital signs and a secondary survey, just to double check that there isn't any trauma that's caused Carmen's nosebleed. Before I start questioning Carmen or assessing how much blood she's lost, I'm first going to ask Carmen, could you just sit forward? Yep, that's the one. And could you just pinch the fleshy part of your nose there? I'm going to get her to pinch that part of her nose for 15 minutes. The type of questions that I would ask Carmen is, how long has her nosebleed occurred for? How much blood does she think she's lost? Has her nosebleed been bleeding continuously for this period of time, or has it been stopping and starting? Are nosebleeds common for Carmen, and is she currently taking an anticoagulant? These questions that I've asked Carmen help me to determine whether or not her bleeding is mild, moderate or severe. So for moderate to severe bleeding or mild bleeding that hasn't stopped after 15 minutes of compressing the fleshy part of your nose or sitting forward, intranasal adrenaline is indicated. Carmen, do you mind if I administer 2 ml of adrenaline into each nostril?
Yeah, that's good.
So now that I've got my patient's consent, I'm going to draw up my adrenaline. I'm now going to draw up my 1 in 10,000 solution of adrenaline. I have a sharps container, a 10 ml syringe, a 3 ml syringe, a drawing up needle, mucosal atomizing device, 1 mg and 1 ml of adrenaline, and 10 ml of saline. Both the saline and the adrenaline have previously been drug checked by my partner. I'm now going to use my 10 ml syringe to draw up 9 ml of saline. I'm just going to put the end of my drawing up needle onto the end of that syringe to keep it hygienic. I'm now going to draw up my 1 mg and 1 ml of adrenaline into the 10 ml syringe. I'm going to dispose of the ampule into the sharps container and recap my syringe. This gives me a 1 in 10,000 solution, or 10 mils. I'm just going to check to make sure there's no bubbles in there. I'm then going to grab my 3 ml syringe and pull the stopper back on the 3 ml syringe to 2 ml. And then I'm going to use the drawing up needle on my 10 ml syringe to push 2 ml into the 3 ml syringe. I'm going to recap my sharps. This gives me 0.2 milligrams of adrenaline, or 2 mils of adrenaline. I'm going to attach my mucosal atomizing device. In an adult, priming of the mucosal atomizing device isn't important because the dead space is very small in relation to the overall volume administered. This is now ready for administration. So Carmen, now that I've drawn up my adrenaline, I'm going to administer 2 ml into each bleeding nostril, alright? Alright, just apply pressure again. So Carmen's going to apply pressure to the fleshy part of her nose for a further 15 minutes. If the bleeding does stop after this, Carmen doesn't have to be transported to ED via ambulance. She can be given a firm recommendation to see her doctor within the next few hours. If we do leave Carmen at home, I'm going to refer back to my non-transport checklist. If the bleeding doesn't stop after this, Carmen should be given a firm recommendation to be transported to ED via ambulance.